Hello, everyone, and welcome to today's Money Talk Tuesday. This is all about Health Connector for businesses. My name is Jack Martin. I'm a program assistant with the Office of Economic Empowerment. We're going to do I'll tell you a little bit about the Office of Economic Empowerment, do some short housekeeping, and then we'll kick it over to Health Connector for their presentation, followed by a Q&A. So the Office of Economic Empowerment is a department within the Office of the Treasurer and Receiver General of Massachusetts, tasked with supporting, advocating, and facilitating policies that empower all Massachusetts residents. Our programs serve women, families, high school students, veterans, and seniors. Our priorities include financial education, closing the race and gender wage gap, racial equity, college affordability, and promoting STEM education. So this is a webinar and not a meeting. As such, you will not be able to view other participants. You can, however, use the chat feature or the Q&A function to communicate with the hosts and panelists or ask any questions you may have throughout the presentation. And if you could please complete the post survey, that would be great so we can continue to improve this program going forward. So thank you very much. To find out more about our upcoming events, including future Money Talk Tuesdays, please visit bit.ly/OEE events. To explore other financial topics, please visit myfinanciallifema.org. And if you have any questions or feedback for us, you can email us at moneytalk@tre.state.ma.us. And we're going to have all this information in the chat. So I'm going to stop sharing my screen and I'll kick it over to Health Connector.
Thanks so much, Jack. And I'm Sarah, who's behind the scenes. My name is Shaitra Sanders, and I'm the Associate Director of the Health Connector for Business. And I am joined today with my associate, Nikki Conte. Nikki, would you like to say hello?
Hi, everyone. I'm Nikki Conte, and I'm the Associate Director of Public Outreach and Education at the Health Connector.
So again, thank you guys for having us. I'm going to share my screen and get into what we're here to provide information on today, which is the Health Connector for Business. And can someone just nod and let me know that the screen is sharing great? Perfect. All right, so the Health Connector for Business, we want to present on it today because it's an affordable way to offer flexible health coverage to both you and your employees. As Jack said, you can put your questions in the Q&A box. We'll be able to answer those questions at the end. We do ask that you try to keep away from asking any personal questions, as we will provide you information for help, assisters or brokers or navigators that will be able to help you with more personalized information. If you do have a question, try to keep it as generic as possible so that we can answer it for everyone who is on the webinar today. So I'll go ahead and get started. And just to give you an overview of what we'll be discussing today, we'll give an overview of what is the Health Connector, what we are hearing back from some employers who have utilized the Health Connector for Business and what they like about it, such as savings, flexible choices, rebates, tax credits. Also, we'll explain how to get started. And Nikki will be assisting me today and letting you all know what's available for sole proprietors, owner-only, family-run businesses that would not be able to shop through the Health Connector for Business. But we'll get into all of that as we go along. So what is the Health Connector in general? The Massachusetts Health Connector is actually the state's health insurance marketplace. And what we do is we offer individuals, families, and small employers access to affordable health insurance coverage. That's our goal. So what I'll be discussing today is the business side of it through the Health Connector for Business, and that is health and dental offerings for small groups here in Massachusetts. Nikki will be talking a little bit more about insurance for people who do not have access to get health insurance through their job or other sources through the individual coverage. That will also cover any sole proprietors, family-run businesses, or owner-only. We want to point out that there is an American Rescue Plan that many of you have heard about, and through the individual coverage, many people who have applied may have more savings due to the American Rescue Plan. So if you've applied in the past and you're thinking of you wouldn't be able to apply, there is the opportunity for you to apply now because there might be more options to help paying for the premiums. And as I stated before, we do offer health and dental. So you can shop for both health and dental through the Health Connector. When you think about the Health Connector, both the individual and the business side, what you think about us is we are a marketplace. And what you'll see is we have all the leading insurers here in Massachusetts available in one location. So think of us as a one-stop shopping solution, both for your business and possibly for yourself. As you can see, here are the health insurance carriers that we have on the Health Connector. And you're probably familiar with at least one, if not all of these insurers, because they are the leading insurers here in Massachusetts. So let me get into a little bit about Health Connector for Business. And so I just want to let you know that the Health Connector for Business is designed for employers who have a business here in Massachusetts with at least 1 to 50 full-time equivalent employees. So if you fall under that, you can come onto the Health Connector for Business and start shopping for health insurance for both yourself and your employees. Now, there are some great benefits of utilizing the Health Connector for Business. First of all, there's full carrier participation. I actually just spoke about that on the previous slide. We have all of the leading carriers in one location, one-stop shopping. We also have competitive premiums. What we have found through employer surveys is that small businesses actually save on average about 20% before any rebates by shopping through the Health Connector for Business. And that's because they can do comparison shopping between carriers, options, plans, all in one location. Again, I keep saying that word one-stop shopping solution, but that's really what we think of ourselves as. There's also wellness rebates. So employers may actually be eligible for a 15% rebate of their contributions into the premium if employees participate and submit one of our 30 pre-approved wellness activities. And I'll talk a bit about that a little bit more in detail in the coming slides. We also have flexible employee choice. This is a thing that's called the employee choice models, and it allows for an employer to set a budget or look at a constant cost for the business while allowing their employees to choose a plan that best suits their needs for their family. And again, I'll talk about that a little bit more in detail in the coming slides also. We also have certified assistants. So we have over 460 certified brokers available to help employers and your employees decide what options are best for your business. And they are free to utilize for Health Connector for Business, any kind of coverage. Also, peace of mind, just to let you know, any plan that's offered through the Health Connector, both on the business and the individual side, meet all federal and state coverage requirements. So when you are shopping for a plan through the Health Connector, you know that you are buying into a plan that will meet federal and state coverage requirements. So you have a peace of mind on that level. There are also some great highlights for the Health Connector for Business that would also benefit your business that we make sure that we have available, such as health savings account compatible plans. So if you're a business and you actually have in place a health savings account, which you might be familiar with, it's a tax advantage medical savings account that is pre-tax. And we have from all carriers at least a silver level health savings account compatible plan that your employees can enroll in if you have a health savings account plan set up for them also, which might be a benefit that you offer your employees or are thinking about offering your employees. We also have out-of-state coverage. The Health Connector for Business has access to PPO plans from certain carriers, and that is in our one carrier model. And again, I'll talk about the employee choice models in a little bit. And again, just as I stated before, all of the plans offered through the Health Connector meet the state's minimum credible coverage, and they have received the Health Connector seal of approval for quality and value. So just really quickly, if you were not shopping on the Health Connector, you would want to make sure that the plan that you were offering your employees meet at least these minimum coverage standards. So as you can see, there's 10 services here. These are the 10 services that must be offered through a plan to meet the state's minimum coverage standard. So you can already feel safe and secure that these are being offered through the Health Connector for every plan that's available, and maybe even more services or benefits. But we know that every single plan through the Health Connector has these minimum standards. If you were shopping elsewhere, you do want to check and make sure that the plan you are offering do have these at least in place at the minimum. So what are employers' experience with the Health Connector for Business? Well, as I stated before, because we have comparison shopping, allowing employers to look at all of the carriers available in one location, we have found that most businesses actually save at least on average 20% by shopping through the Health Connector. And as you can see really quickly, if you look in blue would possibly be a premium through the Health Connector, while in green would be a premium off of the Health Connector for Business. And again, we find that the employers are responding back because they have found that being able to go to one location, shop across carriers, shop across plans in one spot has allowed them to actually save by having access to these in one location. Employers also report back that these 4 items really are one of the main reasons that they have shopped through the Health Connector for Business and stayed on the Health Connector for Business. And that's the employee choice models, which I'm going to talk about, the ConnectWell rebates, the small business healthcare tax credit, which I'll talk about a little bit in detail coming, and also there's no fees or membership dues by utilizing the Health Connector. So no one has to pay a membership fee to enroll in any coverage through the Health Connector, either the Health Connector for Business or the Health Connector for individual coverage. You just need to pay your premium. So let's talk a little bit about these employee choice models that I had mentioned earlier on, and I keep saying over and over again. The reason I point these out is they are very exclusive to the Health Connector for Business. You will not find these special employee choice models anywhere else in the Massachusetts small group market. And again, the goal of the employee choice models is to allow for an employer to control costs while providing their employees with multiple insurance options. And since we are online and everything is located in one spot, it is very easy for employees to compare options and choose the plan that best fits their needs. So those employee choice models are called one plan, one carrier, one level. In the next few slides, I'm going to make these health insurance options pizza instead, because pizza is a lot more interesting to talk about. So how does one plan work? If we were to think of health insurance as a pizza, imagine you and your employee decide to share the cost of a pizza. Now remember, the employee is the one who's actually getting the pizza, but you're going to share the cost of it with them. So one plan works like this. You, the decision maker, the HR person, the business owner, whatever your role is in the business, you decide on the $10 pepperoni pizza from a pizzeria of your choice. You then say, we agree to pay for half the cost. So in this case, the employee is going to get a pepperoni pizza from the pizzeria you have chosen, and they are going to pay for half of it. So the business will pay, in this case, $5, the employee will pay $5. The employee gets the pepperoni pizza, but they didn't really get to make a decision in it. They are going to take the pepperoni pizza from the pizzeria that you chose, and they're going to pay for half of it. So when you take that and you transition it over to health insurance, it looks a little bit like this. So as you see over to the side, there's some metal tiers, platinum, gold, silver, bronze. Those are how we have the benefits labeled, and it really is the higher the metal tier, the less out-of-pocket cost at services, but the higher the premium. So in this case, let's just say, for instance, you, the business owner, decide to offer all your employees a gold plan, this certain gold plan from this carrier, and that's it. They're going to pay for their portion of it, and you'll pay for your portion of it. So that's one plan. Pretty simple, pretty straight to the point. This is not unique to the Health Connector for Business. This is offered across other resources that offer small group coverage in Massachusetts, but we do offer it also. Now, one carrier is unique to the Health Connector for Business. So let's pretend the carrier in this case is the pizzeria. So you as the decision maker decide what pizzeria shop the pizza is going to come from. So you've chosen the pizzeria shop. You then say to your employee, hey, the business can afford to pay for half of a $10 pepperoni pizza, so we're going to give you $5. You don't have to buy a pepperoni pizza, but that's the one we budgeted at. So we're going to give you the $5. The employee can then either choose to buy the $10 pepperoni pizza and pay the other half, or they could choose another pizza and pay the difference. So for instance, if they decide they're going to get the cheese pizza from that pizzeria, and let's say the cheese pizza is $8, well, you gave them $5, so they would only have to pay $3. Or they might say, I'm going to get a Supreme, and so the Supreme might be $15. You gave them $5 towards the pizza based on the pepperoni, and they're going to pay the other $10. So in this case, all you did was choose which pizzeria the pizza has to come from, the budget of the contribution for the business, and then the employees can go ahead and choose the pizza and pay the difference for the one that they choose. So when you change that over to health insurance, what you're doing as a decision maker is deciding which health insurance carrier you're going to offer to all your employees, paying into one of the metal tier plans available, and then allowing the employees to choose the metal tier plan that best suits their needs. Maybe some employees at your company need more coverage than someone else. And so in that case, they can choose to buy up, maybe a gold or a platinum, so they have less out-of-pocket costs when they receive services. Or maybe someone doesn't need as many services and they want to buy down, and their premium will be lower, but their out-of-pocket costs when they get services done will be higher. This really allows an employee to choose the one that best suits their needs for themselves and their family. And it allows for the business to put in a plan that best suits their budget for the business. So similar to one carrier is our one level. So again, let's refer to pizza. One level works this way. Instead, you say to your employees, hey, you all have access to get a pepperoni pizza. So this time you've chosen the pizza that they'll all have access to buy. You then say, you know what, the business can afford the half of the $10 pepperoni pizza from this pizzeria. So we're going to give you $5 towards the pepperoni pizza. You don't have to buy it from that pizzeria shop. You can buy a pepperoni pizza from any shop that's available to us and take that $5 and put it towards that. So in this case, the employees do have to buy a pepperoni pizza, but they can choose it from any pizza shop and pay the difference. So the pizza shop that you chose, it was a $10 pepperoni pizza. Maybe the pizza shop they choose is a $15 pepperoni pizza. They'll pay the other 10. Or maybe again, it's a $8 pepperoni pizza. They'll pay the other 3. It's really allowing them to choose the pizza from any shop that is their preference. And in health insurance, you would think of it like this. You would choose the tier, the benefit tier that's offered to them. So in this case, we're saying, we're going to offer you all a gold plan. Now, the business can afford this carrier's gold plan, so we're going to pay a contribution into that. But the carrier that we chose might not have your doctors, your hospitals, your pharmacies, whatever it is in their network. So you can go ahead and take that contribution, shop across other carriers that do have your doctor, hospital, specialist in network, and you can pay the difference outside. But the only thing is you do have to buy a gold plan. So that allows for you to set your budget and allows for the employees really honestly to keep going to see that same doctor that maybe they've been seeing for years and just pay the difference. So those are our employee choice models. They're very, very unique to us. And by all means, feel free to come on our site, check it out. And there's ways to get quotes, there's ways to view plan options. You can hire a broker, which I'll talk about in a little bit, but it's very, very unique to us. And like I said, our goal is to control the cost of the business while allowing the employees to choose a plan that best suits their needs. Let's go into Connect Well. Connect Well is a way for you as a business to promote wellness in your with your employees, and also to receive money back for offering health insurance to your employees and promoting wellness. So businesses that enroll on the Health Connector for Business and have 25 or fewer employees enrolled can actually participate in this. And what you can get back as an employer is a 15% rebate on the contributions towards the premiums that you put in. If you can get 33% of the employees who are enrolled to participate in a wellness activity. What we have found is that in 2020, the average ConnectWell rebate was about $2,900. At the end of this year, we'll actually be able to find out what the average ConnectWell rebate is for 2021. We're hoping it's the same or more. Again, the rebate that you get back is based on how much you're contributing and how many employees are enrolled. So these can range from, low to high. It really depends on how much you're contributing as a business. Now, employees are also incentivized by participating in a wellness activity. They receive a $100 Visa gift card. And these ConnectWell activities are very light touch. An employee during their benefit year only has to successfully complete and upload one of these activities. And there's over 30 pre-approved activities. We've actually added on activities that they can complete at home, considering. And as you can see, they come from 3 different categories: mind, body, money. So mental, physical, and financial health. And, if you look at some of these samples, they're, look at that, a well visit. They could just go see their doctor for their well visit. It actually doesn't even, a well visit doesn't cost an employee anything out of their pocket because it's one of the zero copay covered services. And the employee can receive a $100 Visa gift card for doing that. And it would go towards the 33% for your 15% rebate. So very light touch. We make sure to help you with this. We auto-enroll groups that are eligible for this. We email employees to let them know that this is available to them and that they should participate. Everything is online, so the employees can submit their activities online and get approved. The employees receive their gift cards the moment their activity is approved. So then they start talking to their coworkers and saying, hey, I got the $100 Visa gift card. And another employee who's enrolled might go on and do it also. We also let you know as a group once you have reached the 33% participation. That way, at the end of your benefit year, you will be receiving that 15% rebate back. And the rebate is money back. So it's not money off next year. It's not a discount. It is actually money back into your pocket. And all of that is reviewed online, and it's very, very easy and light touch. Just make sure you're checking your emails, because that's how we keep in contact with everyone. So just to let you know that it is a real thing, we did a little series before we all went into, remote work. And we brought out some big publisher clearinghouse looking checks. And this business owner, Marcy Berger, owner of Clean Properties, we brought her a check, and she actually replied back. We heard that there would be a 15% rebate. And I said, yeah, I'll believe it when I see it. And here it is. So there she is holding her $4,302 rebate check back. And, she was very happy to see that there was real money to get back from this wellness rebate program. So very briefly, I'm going to talk about the small business healthcare tax credit. This is something that you might be eligible for because you shop on a state marketplace. So that is one of the requirements for this federal small business healthcare tax credit. You have to have your group enrolled through a state marketplace. We are the Massachusetts State Marketplace. So if you enroll your group through the Health Connector for Business, you should be mentioning this to your accountant, your tax professional, whoever it is that handles your taxes, to see if you hit the other requirements, such as covering the 50% of the costs of a employee, having fewer than 25 full-time equivalents with average wages of $53,000 a year or less. That is something that the accountant tax professional can look at and see if you are actually eligible to receive the small business healthcare tax credit. But the key item here is you enrolled your group on a state marketplace, which then opens up the conversation for you and your tax professional. So now that you've heard about all of these great benefits, you're a Massachusetts small business, you're thinking about offering health insurance to your employees, or maybe you're already offering health insurance to your employees and you're like, hey, this sounds like a great opportunity. How do you go ahead and get started? Well, the first thing you want to do is come to our website, mahealthconnector.org/business, and you're going to create an account. You can then offer your employees health insurance on the first of any month. We do not have a closed or open enrollment period. So if you want to offer them health insurance starting February 1st, you would want to hit the deadlines the month prior. So you would want to offer the employees their benefit options the 10th of the prior month. Then the employees in their online shopping account, everything's online, they would want to enroll or waive with a valid waiver before the 20th of the prior month. We then ask for an online payment the 23rd of the prior month, and then boop, the coverage begins for every employee on the 1st of that month. So very seamless. The deadlines actually correspond, as you'll see, with the deadlines for the individual coverage, and everything is accessible online. So no mailing things back and forth, faxing, nothing's going to get lost. So I did mention that we have brokers on the Health Connector for Business, and there are more than 460 certified brokers. That if this is not something that you want to deal with, shopping for health insurance, comparing plans, utilize one of the brokers. They are free to utilize for anything that is Health Connector for Business related. They have access to do really quick, easy cost estimates where they can show you one plan and what it will cost you, and then show you another plan and what it will cost you, and then show you another option. They can put together as many estimates as you need and actually show you this in one location. As well as this is what they do day in and day out. Brokers work on health insurance, dental insurance. This is their expertise. So feel free to utilize them. They understand what they're talking about. They can help you with any questions, and they can really clear up any items that you might not be sure of. As well as utilizing a broker will help you save time. You're running a business, so you probably want to focus on your daily activities for your business. Brokers will be able to take this health and dental benefits item off your desk and just come back to you and help you make a quick decision based on what you told them that you need. So feel free to come to our website. There's a directory and you can actually find a broker who will assist you through there. Now, just to let you know, what I discussed is for small businesses with at least one non-owner that is available through the Health Connector for Business. Those of you who are on our webinar today who are either sole proprietors, owner only, maybe family run businesses, there are also options for you through our individual platform, which Nikki is going to talk a little bit about now. So Nikki, I'm going to throw it over to you.
Thanks so much, Shaitra, and thank you everyone for joining us today. So Shaitra, if you want to go on to the next slide, I'm going to talk about Health Connector plans in general, and then specifically I'm going to talk about Health Connector plans that are available on our individual and family side of the marketplace, just at mahealthconnector.org. So as Shaitra had mentioned before, all plans sold through the Health Connector meet state and federal standards for coverage. So we have both, all of the plans are qualified health and qualified dental plans. And you can see that there are a variety of plans available in various areas across Massachusetts. So Shaitra had shown that slide where you could see all the different carriers in Massachusetts. The same is true. Those same carriers are available on the individual and family side. So if, depending on where you live, you're going to have a variety of options for Health Connector plans. Now, there are a couple of things here, again, that are specific to individual and families. So one is health plans with advanced premium tax credits. So people with incomes in a certain range can qualify for tax credits that reduce the cost of their monthly premium. So we're very excited about this because through the American Rescue Plan, there are actually even additional savings. So more tax credits are available that can help people reduce the cost of premiums. Now, to the right on this chart, you see connector care plans. So there are income guidelines for the connector care program. This is specific or unique to Massachusetts, and people can qualify for low or no cost health insurance coverage through us. And I'll talk in more detail about that further on. I also wanted to let you know that we do sell catastrophic plans. So these are plans that are typically lower in premium costs, but at point of service, they have more costs associated with them. So for example, the deductible for these plans are going to be higher, or if you go to receive a type of, you go to use a benefit, your copay might be higher. I want to acknowledge that these are there, but also like to caution people about, that availability and why that cost is so low. So as you can see from the slide, it's available to people who are under 30 years of age, or if there's a hardship exemption. Now, Shaitra talked about dental plans a little bit. So I just want to reiterate, again, they're available for individuals, families, children, and small employers. We offer pediatric only plans, as well as plans with lower and higher deductibles. And then lastly, of course, just to reinforce what Shaitra was talking about, we have our Health Connector for Business program. And again, this is for small employers with less than 50 full-time equivalent employees. So going on to the next slide, we're pleased to be able to present to you right now because we're in the middle of open enrollment. Now, this is open enrollment for individuals and families. So it's the time of year when people can apply for new coverage for the coming year, or renew coverage, or just shop for a new plan entirely. So open enrollment began on November 1st, and it's going to end on January 23rd. For all Health Connector plans, so if you are a sole proprietor and you're thinking, oh, okay, maybe I should go this route. Maybe I should go through the individual and family side at mahealthconnector.org. Health and dental coverage can start as early as the first day of the month after you enroll. So our big deadline on the individual and family side is the 23rd of the month. So keep that in mind, and I'll keep coming back to the number 23. I always like to tell people though, especially since circumstances have changed so much in the last 1.5 to 2 years, if you are someone that doesn't have coverage and you need coverage right away, just apply right away. Some people find out that they qualify for Mass Health. Now, I just want to explain this for a moment. The Health Connector is a separate entity. We're a quasi-public agency. However, we are very closely tied with our sister agency, Mass Health. And when an individual or family applies for coverage, they're going through one single application at mahealthconnector.org. They don't necessarily know what they're going to qualify for. So if you are looking for help paying for coverage, you simply want to complete the application, indicate that you want some help paying for coverage, and people basically get filtered through the system, and some people do land in Mass Health. So I just want to be sure to explain why that could happen. So going on to the next slide, people ask, okay, if I apply for mahealthconnector.org, really who should be applying? How is this possible? So first of all, again, Shaitra said, we're the marketplace for Massachusetts. So if someone needs to live in Massachusetts, they need to be legally here in Massachusetts. So for example, you need to be a US citizen, a US national, or just otherwise lawfully present in the United States. And you need to be someone who doesn't have access to health insurance coverage. So if you are someone who is already enrolled in Medicare, the Medicaid program in in Massachusetts, it's known as Mass Health, or you have any other type of public coverage, so certain VA benefits. Basically, and this is a very important one, or if you're offered affordable comprehensive coverage from an employer, you should not be coming to mahealthconnector.org. As you go through our system, you will be asked questions about any coverage that is offered to you. And for example, if you're already getting some other type of government-sponsored insurance, let's say you're Medicare eligible, our system's not going to let you come through the other side. Similarly, for those who have an offer of ESI, employer-sponsored insurance, we're going to ask you some questions about that employer-sponsored insurance. So we just recommend that if someone believes their employer-sponsored insurance is not affordable, you want to gather some information from your HR department, because we're going to ask you some pretty detailed questions on the application about that coverage. So going on to the next slide. What do you need to apply? So I like to tell everybody to gather social security numbers for everyone who's applying, if they have one, immigration documents for anyone who's a non-US citizen. If you are, thinking, okay, I have these documents, I'm not sure exactly what they are, you can go to our website, or after this presentation, you'll get access to this PowerPoint deck. You can click on the links here. There is a link to our website, and you can just take a look at the chart of immigration documents. And we do a pretty good job of showing them, explaining what they are. Now, I mentioned that there's a lot of savings available for people right now, especially not only through our existing programs, but especially through the American Rescue Plan that was just passed earlier this year. So we need to know about people's income. We need to know about their household income. So as an example, I would want to gather copies of last 2 pay stubs. If someone's collecting unemployment, you want to get the monetary determination. So we need to know about unemployment income. If you didn't file taxes last year or your income has changed, we just need current information about your income. And particularly if you're a sole proprietor, we want to understand the net income from your self-employment. So think of various ways that you can gather this information. Of course, if you don't have all of this information, we don't want you to wait to apply. We want you to, you need access to health insurance coverage. We want to get you in as quickly as possible. So gather everything that you have. If there's something more we need, you're going to be notified at the end of the online application. You're going to get to a screen and it's going to tell you what you're missing. You'll also get a letter from us that explains what you need to supply and a deadline for supplying it. So important to note here is if you owe us a document, you can also upload that document once you gathered a copy of it. You can upload it from your phone, for example. You can upload it to your application. So going on to the next slide, I mentioned this, but I want to explain this a little bit further so I know people can understand it. So I talked about having or being able to give more advanced premium tax credits. So the way the premiums are reduced on the individual and family side is through tax credits. So they lower the premium that you, the consumer, will pay each month. Now, the IRS is going to send your tax credit. So you'll find out what you're eligible for, but the IRS sends that tax credit directly to the health insurance carrier that you've enrolled in. You just simply pay less each month. And you, as the consumer, depending on how many tax credits you qualify for, the total amount, you can choose to apply all of that amount or just some of that tax credit towards your monthly premium payment. And you might be thinking, why would I not just take the full amount? And particularly for those who have fluctuating income, we've heard from people who run small businesses or run their their own thing, and their income might fluctuate throughout the year, and what they're showing right now for income might be lower. The next season might be higher, and they know it. So you just want to know your own situation, and you can plan accordingly. Now, I mentioned the Connector Care program. So the Connector Care program is that program that is unique to Massachusetts, and it uses federal advanced premium tax credits plus some state dollars, and those two together reduce the premium amount that you, the consumer, pays each month. Connector Care has low monthly premiums, low out-of-pocket costs, no deductibles for the Connector Care program, and depending on the plan type you qualify for, you could be paying as low as $0 or $133. I think right now it's like $135 per month. So really reasonable monthly premiums. And again, the great benefits, very, very good benefits. So I talked a little bit about income guidelines. So specifically for that connector care program I was just describing, if you are a household of 3 and you're generating $65,160 or less, you could be eligible for that connector care, those connector care plans. Again, very good benefits, very low monthly costs, no deductibles. Now, moving on to kind of this yellow box on the right, I keep talking about the American Rescue Plan, and you almost need to disregard the income guidelines that are below where it says APTC. So disregard that for right now, because through the American Rescue Plan, those guidelines get removed. And some people over 400% of the federal poverty level may now be eligible for help paying for their coverage. So the way the system figures it out is it's based on the affordability of plans to the consumer. So there's going to be a set amount. If you, the consumer, have a household income of X and the plans that are available to you are more than Y, you may be able to get some tax credits to basically create a buffer and give you some savings. So going on to the next slide, just like Shaitra had mentioned about getting free help, there is free help on the individual and family side. So it's free enrollment assistance, and you can go to both either the Health Connectors customer service, you can get on the phone and call them, or you can get access to help in your community through these partner organizations. So the number for customer service is 877-623-6765. You can see we have a line for anyone who needs assistance if they're deaf, hard of hearing, etc. Also on our website, you can find hours of operation, days that we're open. In particular, during open enrollment, there are certain Saturdays that we're also there. And again, that is to help enrollment for January 1. Now, in terms of community partners, similar to the certified brokers that Shaitra was talking about, we have certified navigator grantees. We also have certified application counselors. These people are sprinkled throughout Massachusetts. I think, Shaitra, you said you had over 400 certified brokers. I think we have at least 1,200 certified assisters. They speak lots of languages. They're very reflective of the communities in which they work. They can help people from application to enrollment and can essentially answer questions, any kind of questions for you. Now, particularly right now, since we're in open enrollment period, I would suggest if you wanted help from one of these folks that you do need to call the organization, call ahead, make an appointment. So it's on your schedule, it's on their schedule. And if you want to find someone close to you, you can go to this link here and it's Get Free Help Near You. If you just want to check out the organizations, you could go to mahealthconnector.org/navigators, and you can see all of the 19 navigator organizations. Again, great people, lots of expertise. Going on to the next slide, I just wanted to talk a little bit about reminders. I'm going to do a couple, and I'm going to hand this over to Shaitra to talk a little bit as well. But when you are a small business and if you for whatever reason don't qualify for offer coverage through Health Connector for Business, remember that you can get coverage on mahealthconnector.org. Now, as I mentioned before, the 23rd is a very important date. So you're going to need to apply, enroll, and pay the first monthly premium by the 23rd of the month before coverage can start on the 1st of the following month. So for example, if you're looking for coverage to start in January 1 of the new year, you need to take action and do all of these things and pay by the 23rd for that to take place. Now, technically speaking, I have to tell people that this is true. So if they see this, they're not concerned. If you apply, you're getting to the point of enrolling, you can also choose to have your coverage start on the second month after you enroll. So sometimes people just are, good doobies and they're doing this ahead of time. So you can in fact choose to have coverage start on the second month after you've completed the application. So with that, I just wanted to turn it over to Shaitra to just kind of talk through some of the other reminders here for small business owners.
Thanks so much, Nikki. And, again, 23rd, we decided on the small business side to also go with the 23rd. So for any groups on here who are eligible to enroll through the Health Connector for Business, meaning that there is at least one non-owner enrolling for coverage and that the group has 1 to 50 full-time equivalent employees, you'd want to follow, again, the deadlines. And just to remind you, small businesses through the Health Connector for Business do not have a closed or open enrollment period. They can offer health insurance to their employees starting the first of any month. So if you're not ready to start offering health insurance right now, maybe you come back and visit us in a couple of months, that's fine. Just remember that you have to do everything by the deadlines of the prior month. You have to offer the health insurance through your online account by the 10th of the prior month. The employees have to enroll or waive by the 20th of the prior month. And there's that good old 23rd. The first payment needs to be submitted online by the 23rd of the prior month for the health insurance to start on the first of the month that you offered it. And now I think Nikki and I are prepared to take any questions from Jack over here.
Yes, thank you very much for the very informative presentation. I think this is incredibly important for small businesses looking to offer health insurance for their employees. For anyone in the chat that has any questions, you can leave them either in the chat box or the Q&A feature through Zoom. We do have some questions prepared, so we'll ask some of those while those fill in. So here's one question. If someone is a business owner and they don't have any non-family employees, could they purchase coverage through Health Connector for Business?
So as we stated, if there's no non-owners enrolling, then they would not be able to purchase through Health Connector for Business. But as Nikki talked about in the other half, there are some great options through Health Connector through the individual platform. And as an owner, you might be eligible for some tax credits. Nikki, would you like to emphasize on any of that?
No, Shaitra, you actually hit all the key points. You just want to go to mahealthconnector.org to get started. So very similar website, but individual and family side of the house, we're happy to help you and see what kind of plans you can enroll in.
Excellent. And for another question, if someone is a business owner without employees who hires an employee during the year, could they enroll in Health Connector for Business mid-year?
Yes, that's the great thing about Health Connector for Business. There is no open or closed enrollment period. So if you're currently right now, maybe just an owner only, maybe you are getting health insurance through Health Connector or anywhere else, and then you hire on an employee, maybe you hire them mid-March and you're like, oh, I really want to offer them health insurance. You could offer them health insurance for the start of April. So you could put into a plan into play April 1st. So that's the great thing. A group plan can start the first of any month on the Health Connector for Business.
Great. And I think we have time for about 2 more questions. So are there any membership fees to buy coverage for employees through Health Connector for Business?
No, both the Health Connector for Business and the Health Connector are free platforms for you to use. You do not have to be a member. You do not have to pay a fee. You don't even have to pay for assistance. As we stated, there are free brokers for the small businesses, and there are free navigators and certified application counselors on the individual and family side. So the only thing that anyone is really looking to pay is their premium.
Excellent. And we'll leave it off with this last question. If someone's an employer based in Massachusetts, but their employee lives out of state, can the employees still receive Health Connector for Business coverage?
That is great. A question. In a slide very early on, I mentioned that we do have out-of-state coverage. It is offered through our one carrier model. So if you remember the pizza slide where I said you choose the pizza shop, a PPO, which is the option that would allow for out of network, which out of state benefits, would be offered through the one carrier model. So as a business owner, you can offer the one carrier model, maybe pay into one of the other plans. You don't have to pay into the PPO plan, but if you have an employee who needs that option, they would be able to choose to enroll in that. So yes, as a small owner, especially where we're so remote currently right now, and people are hiring all over and everything, coming to the Health Connector for Business, you can offer out of state health insurance that would cover by offering the one carrier model.
Excellent. Well, I think that will be just all the time we have for today's Money Talk Tuesday. I'd like to thank you both again for a very informative presentation. This is incredibly important. And if you'd like to learn more about our upcoming events and webinars, you can visit bit.ly/OEE events. But that will do it for today's Money Talk Tuesday. I'd like to thank everyone for joining us and have a great rest of your day.
Thank you so much, Jeff.